Have you heard about the new COVID-19 variants that are raising concerns in the US? It's true. The healthcare community has identified 4 new subvariants of COVID-19. These include EG.5, HV.1 BA.2.86 and JN.1. Now don't be alarmed. Despite their prevalence, EG.5 and HV.1 are not seen as major threats. However, their very existence underscores the virus's ability to adapt and change, a factor that demands our vigilance. Stay tuned as we delve into each variant one by one. First, we focus on the EG.5 variant. This particular variant has been making its presence known across the United States. In fact, it's found in nearly half of all COVID-19 cases. That's a significant portion, isn't it? But before we let panic set in, it's important to note that EG.5 is not considered a major threat. Now, this doesn't mean we can afford to be complacent. The prevalence of EG.5 underscores the virus's ability to mutate and evolve, a characteristic that has kept health professionals and researchers on their toes since the pandemic began. Each new variant serves as a reminder of the importance of consistent monitoring and continued research. Despite its widespread presence, EG.5 hasn't caused a surge in severe cases or hospitalizations. This is encouraging news, but it doesn't diminish the need for continued vigilance. Remember, the best defense against any variant, be it EG.5 or another, is vaccination coupled with responsible health practices like masking and social distancing. Now let's move on to the next variant, HV.1. Next, we delve into the details of the HV.1 variant. This variant, part of the latest set of subvariants of COVID-19, has raised some eyebrows in the healthcare community. Its presence has been noted in nearly half of all COVID-19 cases across the United States, painting a vivid picture of its prevalence. However, before alarm bells start ringing, it's important to underline that HV.1 is not considered a major threat. This may seem surprising given its widespread nature, but let's delve a bit deeper. The severity of a variant is not solely determined by its prevalence. It also depends on its potential to evade immunity and its impact on vaccine effectiveness. In the case of HV.1, while it is prevalent, it hasn't demonstrated a significant ability to bypass the body's defenses or render existing vaccines ineffective. The general consensus in the scientific community is that, while HV.1 is on our radar, it's not setting off any major alarms. It serves as a reminder that the virus continues to evolve and we must remain vigilant. So while it's worth keeping an eye on HV.1, it's not the variant causing the most concern. Now let's shift our focus to the more concerning variants, starting with BA.2.86. Now, let's talk about the BA.2.86 variant. This variant initially sparked some alarm bells in the scientific community due to concerns about vaccine effectiveness. The fear was that our current arsenal of vaccines might not be as potent against this new enemy. However, as we delve deeper into the data, a reassuring trend began to emerge. Recent studies have shown that the existing vaccines should still work against this variant. Although the BA.2.86 variant may be different, it seems our immunizations are versatile enough to tackle it. This is a testament to the robustness of our scientific advancements and the versatility of these vaccines. But it's important to remember that the situation is fluid and ongoing research is crucial. The constant evolution of the virus means we must remain vigilant and proactive. Individual precautions such as masking, social distancing, and vaccination remain our best defense against this variant and indeed all variants of the virus. Finally, we will discuss the most concerning variant, JN.1. Lastly, we explore the JN.1 variant. This intriguing subvariant is a progeny of BA.2.86 and has developed a rather unsettling capability. It possesses the ability to evade our immune defenses, a trait that potentially leads to breakthrough infections even in individuals who've been vaccinated. Yes, you heard that right. The JN.1 variant can potentially bypass the protective barriers provided by our current vaccines. Now, before you let the worry creep in, let's look at the bigger picture. Even though JN.1 has been detected in Kerala, India, it is not yet considered a risk there. This is primarily due to the ongoing efforts of healthcare professionals who are monitoring the situation closely. Remember, the main armor we have against these ever-evolving variants is our vigilance, regular testing, maintaining social distancing, wearing masks, and getting vaccinated are our best defenses. The constant evolution of the virus underscores the need for vigilance and monitoring. In conclusion, while new COVID-19 variants continue to emerge, the need for individual precautions remains. Let's recap. EG.5 and HV.1, though prevalent, are not currently considered major threats. BA.2.86 initially raised eyebrows, but existing vaccines should still be effective against it. The real concern lies with JN.1, a variant that could potentially bypass our immune defenses. These findings underscore the importance of continued vigilance, social distancing, masking, and vaccination. Furthermore, researchers are tirelessly working on updated vaccines to tackle these new threats. Stay safe, and remember, we're all in this together. Please subscribe to this channel. Your single membership is extremely valuable for our growth and motivation. To receive regular updates, click the bell icon.